We are Group 11, and we will be discussing our case study, which focuses on youth asthma and breastfeeding in the U.S. Background on asthma. It is a complex chronic disorder of the airways, which has increased in prevalence from 7.3% in 2001 to 8.4% in 2010. The annual cost of asthma is estimated to be nearly $18 billion, with prevalence highest in children, females, and individuals of low SES. And of the many prevention strategies, we chose to focus on the role of breastfeeding in asthma for this case study. And in our first Ask the Expert segment, we will be asking Dr. Tara Bartow, a pulmonologist, about the increasing prevalence of asthma within the population.
Good afternoon, my name is Tara Bartow. I'm an adult pulmonologist here at Baylor Clinic, and I've been asked to speak a little bit on asthma prevalence rates. And the overarching theme is that it seems as though asthma is actually increasing in the United States, and there's quite a number of theories out there about why that may be or may not be. And the first concept that really is under debate is really the definition of asthma, because there, especially in pediatric asthma, there is a dramatic increase in the diagnosis of asthma, and the question being is what is the diagnosis of asthma, and how is it coded, and how is it, is there a difference between asthma diagnosed by a general pediatrician versus asthma diagnosed by an ER physician versus asthma diagnosed by a pediatric pulmonologist? And I think a lot of that confounds the data. But if you are to accept that there's actually an increasing prevalence in asthma, which I really think there probably is, some other theories being that there is a delay in infections in the pediatric population, and by that I mean there's been increased awareness of both viral infections and bacterial infections and prevention of those, although the concept being that as children get these minor illnesses, they build up an immunity to them, which then can help protect them against other types of diseases. So the fact that children are staying home more, less daycare, more homeschooling, less interactive schooling in a general population is also a theory as to why this might be increasing. Not to mention some of the well-known factors of increasing pollution and cigarette smoke and things along those lines.
In this case study, we used the Youth Risk Behavior Surveillance Survey to acquire data, and this survey looks at behavioral risk factors in 9th through 12th grade students, and it's conducted biannually, usually during the spring, throughout the nation. In our second Ask the Expert segment, we will be discussing the YRBS with Sanford Johnson, who is a public health professional.
Hi, my name is Sanford Johnson from Mississippi First. We're a public policy nonprofit based here in Mississippi. And I want to tell you how the Youth Risky Behavior Survey is helping us reduce our teen birth rate, which is the highest teen birth rate in the nation. Through our partnership with the State Department of Health as well as the Women's Fund of Mississippi, we established the Creating Healthy and Responsible Teens policy. It's the Abstinence Plus policy that we have here in the state, which is one of the two options that school districts were required to adopt this past year, either Abstinence Plus or Abstinence Only. We went with Abstinence Plus, of course. Through our policy, through the CHART policy, districts were able to adopt evidence-based sex education that was designed to delay the start of sexual activity, reduce the frequency and number of partners, as well as increase correct and consistent condom use. We were thinking that this strategy, and we believe that this strategy will significantly reduce our teen birth rate as well as our infection rates for chlamydia, gonorrhea, as well as other STDs. Part of our strategy when reaching out to the districts is to share with everyone in the state how serious this problem is, how high our teen birth rate is, how high our STD rates are. However, there were a lot of people in the state that believed in some of the myths that have been going around for years, thinking that our teen birth rate was only a problem in certain parts of the state, is only a problem in certain demographic groups. Essentially, they thought it was just a Delta problem, it was just an African American community problem, or it was just a low income problem. With the use of the YRBS data, we were able to share with everyone in the state that this is a statewide problem. We have sexually active teens in every corner of the state, and those students that are sexually active have very little knowledge about sexual and reproductive health. They don't know how to set boundaries. They don't know how to communicate those boundaries. So using YRBS was very helpful. And we're hoping that we can use this going forward as we start working on obesity and some of the other health issues that are affecting the quality of life here in Mississippi.
And here is a table showing breastfeeding and asthma prevalence. As you can see, there was no significant difference between the rates of asthma diagnosis and breastfeeding among the 3 states compared: Texas, Utah, and Mississippi. And part of our case study was geocoding asthma prevalence data for the YRBS. We accomplished this by using the BatchGeo software. And as you can see by both of these maps, comparatively, Texas has a low asthma prevalence compared to the nation. And in our final Ask the Expert segment, we will be talking with Christina Tucker, a lactation specialist, and she will be telling us about the importance of breastfeeding.
Here at Texas Children's Hospital, we consider breastfeeding as the standard and norm for infant nutrition, breastfeeding and human milk. We follow the American Academy of Pediatrics recommendations of recommending exclusively providing breast milk for infants for the first 6 months of life, and then continuing through the first year of life, along with complementary foods, which would be introducing solid foods between 6 months and 1 year. The evidence is so strong now for both immune factors, neurodevelopmental factors with human milk that it's considered the standard for infant nutrition rather than it being the benefits of breastfeeding. Now we talk about it, and pediatricians talk about it as the risks of not providing breast milk for infants. There are documented benefits for mom and baby long term. At Texas Children's Hospital, we're very proud of our lactation and milk bank services. We have a team of 12 lactation consultants that provide care to mothers that have infants in the neonatal intensive care unit and the cardiovascular care units, as well as the pavilion for women where our Well Baby nursery is as well. In addition to infants and mothers that come to the hospital for any reason at all. We also utilize lactation assistants, which are peer counselors for mothers, and they're a great asset to our team. We also have what we call a milk bank, and what a milk bank is for our newborn center, which is our neonatal intensive care unit. Mothers that are pumping breast milk for their babies bring it to us. We store it and prepare it for infant feeding in the NICU, and we feel like it provides the excellent quality in terms of storage and preparation, and ensures that babies get the highest quality food that they can get, nutrition that they can receive.
As you can see, the first map shows the prevalence of breastfeeding throughout the U.S., and the second map is showing that comparatively, Texas has a higher rate of breastfeeding than most states across the nation. We recommend that future research should be focused on the influence of race and gender on asthma prevalence, and possibly looking at the relationship between breastfeeding and asthma in children closer to breastfeeding age, which would be between 3 and 12 years old. To conclude, we identify that the YRBS by itself has certain limitations. The most important is high prevalence of one variable with another does not imply association. And we would like to give a special thanks to all of our experts for sharing their views with us, and thank you for watching.